Assalamualaikum warahmatullahi wabarakatuh. My name is Amariko Najmi. This is my friend Ifan Hadi from RSR 134E, and today we'll be doing an interview with an injured athlete, and we'll be asking a few questions. So I will let Ifan Hadi to start it.
Okay, Assalamualaikum. Okay, I'm Ifan Hadi. So I'm going to introduce my subject for today. Okay. Can you introduce yourself?
Okay, my name is Muhammad Faris bin Muhammad Sabri from RSR 134E.
And what's your age and where do you stay?
Okay, my age is right now is 20 years old and I live in Melaka.
Okay, for now, what is the sport that you have been involved?
Okay, for now I involved for futsal about 4 years already in amateur and semi-pro competition.
So as we know, you have an injury. So I want to ask, what is happening at the time?
Okay, in that time I was in training and then I tried to save the ball from getting in and then I feel pain.
So can you tell us where is the exact location that the pain has been felt?
Okay, I've been felt the pain in my hamstring right here.
So after that, do you take any treatment?
Yes, I take treatment which is rest, ice compress and elevation.
Then do you go to the clinic or somewhere?
No, because my mom is nurse, so she advised me.
Okay. So at this time, does the injury occur while you are playing some sport?
No, I don't feel anything. So I
So
think
you can play just like normal.
yes.
Okay. As you already informed that you feel pain on your hamstring, can you be more specific? Do you feel any like sharp things stabbing your hamstring or tingling or any other symptom?
Yes, actually I feel like a sharp things in my hamstring because my muscle already there and it's really pain.
Okay. In that location, is it spreading or deeply or superficial?
No, it is not spreading. It is actually located in my hamstring only.
Okay. Can you describe or giving us a scale or rate, either 10 until 0 to 10? How much you would rate the pain?
I think I will give it 7 out of 10 because I think it is hard for me to working like usually like normal because it is hard. It is hard in my hamstring.
Okay. Do you feel any pain when you do any activity and when you rest? Do you feel the pain of injury?
When I am rest,
Yeah, rest and doing any activity.
when I am rest, I don't think so. But when I'm walking, running, yes, I feel pain in my hamstring.
Okay. Through the days, like every single day, is it the pain get worse progressively?
No, I think it is become better because I already take the treatment.
Okay. This is something that commonly happen in an athlete. Does the pain tends to be worse during night? Like when you sleep, does it get worse?
No, because there is no activity, so I don't feel anything.
So the pain doesn't cause you any cramps during your sleep?
No.
Assalamualaikum. Today I will do some tests to know the exact location of this athlete injuries. Okay, I will start the test. Do you feel any pain or any test? Serious?
Yes.
To the second test. Do you feel any pain?
Yes.
From scale 1 to 10, how much is your pain? Oh, okay.
Now I will do a special test which include 3 sections which are actively, passively and against resistance. Okay, I will start with active range of motion. For this room, the athlete will actively contract the muscle by themselves without any help. Now I need you to lying down and bring one of your leg up for 8 to 10 seconds. First you can do left leg. 1, 2, 3, 4, 5, 6, 7, 8. Next, the right leg. 1, 2, 3, 4, 5, 6, 7, 8. Next is basic range of motion. For this rope, I will help the athlete to move the injured part until the point of the pain. So I need the athlete to lie down for do the hamstring curl. So I will push your leg, and if you feel the pain, you must tap the floor. Right leg.
Now I will do the resistive strength training, which is it include into 2 sections. There are mid-range of motion, muscle testing, and also specific muscle testing. So let's go. Next, for mid-range of motion muscle testing, it will focus on muscle groups. So now we will do for the mid-range of motion muscle testing. So firstly, my subject, we also need to lay down. Okay, and then one leg need to raise. So for the first thing is I will push this leg with a slow pressure, and then I will push this leg also with a strong pressure. So that is for mid-range of motion testing. This is with a slow pressure. How do you feel?
I feel okay.
So release. And next with a high pressure. Do you feel okay?
I feel hurt in my hamstring.
Next, for the specific muscle testing, the test will be on a specific muscle, which is a hamstring, not a muscle in groups. So now we do the specific muscle testing. We will do the test on the both of leg, right and left, and there are 5 grades for specific muscle training. Okay, so please lay down your backward. Your first is your right leg. Okay, this pressure I will push. It's connected with the 5 grades that I tell before that. Okay, now I will push for the first grade with low pressure. Okay, it's take for 8 until 10 seconds. Okay, we start from now. 1, 2, 3, 4, 5, 6, 7, 8. Okay. Do you feel okay? Okay, now we go again for second grade. Ready, go. 1, 2, 3, 4, 5, 6, 7, 8. Anything? Do you have pain? For third grade. Ready, go. 1, 2, 3, 4, 5, 6, 7, 8. For the fourth grade, go now. right leg. Okay. With the height pressure, you can see it's feel okay or not. We go 3, 2, 1. 1, 2, 3, 4, 5, 6, 7, 8. Okay. Okay, next for the left leg. Same goes with the same grade, and I will start with a low pressure. Okay, this is first grade. Okay, release your muscle. Okay. Anything if you feel not okay, you just tell me. Okay. So let's go. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8. Release. You feel okay? Okay. For the second grade, we go 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8. Release. Okay. This is for the third grade. So 1, 2, 3. 1, 2, 3.
No. My hamstring hurt.
So for the it's only can go for the third grade, and it feel a little bit tingling at his hamstring, and yeah, it feel a bit pain of his hamstring.
So after the test that has been done, we can see there are no serious injury. But if the injury getting worse, I suggest you to get a treatment at clinic. The provider will test you, use ultrasound and MRI. For ultrasound, the provider will use the ultrasound to check for tears of fluid build up around your sprain muscle. And for MRI, the provider will check for blood clot or internal bleeding. These tests will also help them see if the injury damage any other tissue. So here, what you need to do about your muscle tear treatment. To begin, apply the RICE method, which R stand for rest, I for ice, C for compression, and E for elevation. So first and foremost, you must relax and refrain from engaging in any activities that produce pain, swelling or discomfort. You should also refrain from putting any weight on the injury area for the next 24 to 48 hours. The second step is putting ice on the injured area. Ice has long been used to relieve pain and swelling. Every 2 to 3 hours, use an ice pack covered with an adhesive cloth for 15 to 20 minutes. So the next step is compression. Compress the affected area with an elastic bandage until the swelling subsides. If you wrap it too tightly, blood flow will be blocked. So just too smooth. Last but not least, elevation is the final phase. Elevate the wounded area above your heart level, especially at night, to allow gravity to assist in the reduction of swelling. In addition, you can do massage for your muscle tear. The massage named therapeutic massage. The therapeutic massage helps loosen tight muscle and increase blood flow to help heal damaged tissue. So that's all my advice for you.
Okay, thank you for advice. Okay, so I will take your advice.
As for today is I will give a feedback for my subject. Okay. My observation and inspection for mid-range of motion muscle testing. He go this testing with gratefully, and I will describe he into a strong and painless, which is it's a normal muscle with his leg. And for the specific muscle testing, which is it contribute both of his leg. Okay. For the right leg, I will give but the result is that I have is the right leg in a grade 5, and for the left leg is for the grade 3, which is it's a fair condition for his leg.
Okay.
So that's all from me and my subject. Thank you.